This is another episode of the League of the Genuine Conversations with me, Fred Muwema. We are here to deliver yet another episode. We have been having a discussion on counterfeits in the trade, business, and enterprise industry sector. But there is no denying that we're in difficult times. We're in terrible times. We have a COVID lockdown. We're losing loved ones. Many are sick, struggling for their life. Young, old, women, children, everyone is in a dark moment at this time. From the League of the Genuine, we would like to condole with you, sympathize with those who are sick, those that are battling in hospital or at home, the relatives, the friends, everybody's affected. Of course, we should also like to recognize that there are those who have made it, those who have survived, those who are there to give a testimony. I'm sure each one of you has got people on either side, the survivors and those who have not made it. So even if the discussion relates to trade and business, we think that it's opportune that we deal with the issues of the day, which is this new and big scare of COVID, the new versions or variants that we have, which have forced us to be at home. And for us, we are here at Protea Hotel in the Central Business District of Kampala. We can't be in our studios. And we are here because this is the only place where our guest could come. Join me in welcoming Dr. Samuel Opio Acuti. Doctor, you're welcome.
Thank you.
The last time I saw you, Doctor, you were Mr. This was several years ago because you have been there since we started the Anti-Counterfeit Network. How did you transform to a doctor?
Yeah, well, first of all, thank you everyone for tuning in, and thank you for the invitation to this particular show. And also want to appreciate ACN for the great work. The same way we've seen the transformation of ACN is the same way I've been able to transform into a doctor through acquisition of additional education, but also not just have I added the doctor title, I've also added the honorable title, which has brought me to be a member of parliament. So on one arm, I have the political side. On the second arm, I have the technical arm. And the two are integrated together. I don't know when you integrate together, what comes out of that.
Sometimes you get poison because when you do the mix badly.
Yes.
Dr. Sam Opio is the MP, a new MP of Kole North. Kole North is in Lango sub-region,
yes,
in northern Uganda. Why I was saying it can be poisonous, because at the moment, the people having a lot of stick and backlash from the public during these COVID times are the politicians who everybody believes they are just getting free money, and a lot of backlash and stick is being given to the doctors, the medical practitioners, for the many things they are doing and overcharging, and people are dying. How are you taking the hit both as a politician and as a doctor during this COVID menace?
Yeah, so I think it's very important to understand that taking the heat only comes in when you're not able to quench the fire. And quenching the fire means that you must be in direct contact with the people. But secondly, you must be a solution provider. And that's what I've tried to endeavor strongly as the Secretary General of the Pharmaceutical Society of Uganda. We've tried to provide solutions in the midst of all the different challenges of supplies, of falsified medicines, of difficulties in accessing treatments, high costs here and there. And the beauty about it is that when you're a technocrat and also a politician, is that you can understand the issues better and you can provide more practical solutions. And I think that is what has enabled me take the hit and be able to provide solutions that can address the issues at hand.
You are now in Kampala, but being an MP from an upcountry, rural part of the country, the people in the city, many do believe that maybe COVID, even when you saw the map the other day, the president was showing, the concentration, the incidence is more around Kampala. So is it that in Kole North you don't have COVID?
Yeah, so what we need to understand is that the data that is being presented is based on the number of people tested. But also, it also depended on availability of the testing facilities. If you look at Kampala, already there's a very strong testing infrastructure from both the public sector and also the private sector. If you go into villages, you can imagine an RDT test costs 100,000 shillings. A PCR test is 300,000 shillings. So we have a lot of potentially undocumented cases. But we also have a lot of unreported tests that have been done in some of those areas. So it's partly due to challenges of reporting. It's partly also due to challenges of high costs of testing and accessibility to testing. So it is not a clear indicator that you have a bigger burden in the city than in the upcountry areas. Remember that even before the lockdown, there was a lot of movement of people from the city to the upcountry areas itself. We do not know what the impact is. So that is a kind of indicator, but it's not confirmatory in nature, that there are lesser cases.
So what you can say is that even upcountry we have a situation with COVID there.
Yes, we have a challenge. My own constituency, we've seen this in about the last 2 weeks. There are about 70 cases, positive cases that were reported, and we've had about 3 deaths. So it is not because we don't have lesser cases, but it's just that there's less reporting, but also less availability of the testing arrangements to support that itself.
So, Doctor, this show, as you know, we are trying to sensitize the consumers, the public, because everybody is a consumer, about counterfeits. We find a hard time making this attractive to many people, because many people do not think it's a big problem. So what if they are fake tires, fake tomatoes? For me, I get my tomatoes from a good supplier, so they may not want to pay a lot of attention. In the past few days, there has been an outcry with reports about fake vaccines for COVID, even with reports about some reported fakes of COVID-X. What is the narrative that can be given, or which you can give now as a doctor, to people to start taking counterfeit seriously? Not just because there's a fake vaccine, but because people are always permissive and they live with and accept counterfeits of milk in their midst. What is it you can tell people not to only express shock when a vaccine is fake?
It's important to understand, first of all, that any item that is fake has a very strong potential health impact. Even that phone that is fake could be emitting a lot of radiations, which can potentially harm you. That electronic, that radio that is fake can also be emitting some radioactive waves. We need to understand that when you look at any fake item, whether it's a battery, even a battery which you're using in a car, it may be disposed and it becomes an environmental hazard, and eventually it impacts the environmental health and human health. So people need to understand that as the first primary thing, that counterfeits have an impact on health, even when it is a non-health related commodity. That is one element. The second thing we need to realize, when we go into medicines, it's even a very big issue, because a counterfeit phone, you can possibly return it back to the supplier. But a counterfeit vaccine, it has entered your body. How are you going to retrieve it? You even do not know what has entered your body. A counterfeit drug, it has already had its effects on your liver. How do you reverse that? It is irreversible. That is the second thing people need to understand. So there's a health impact, and at times it can be irreversible and have dire consequences on matters to do with life. So it's very important for people to understand the seriousness.
Here on the League of the Genuine, we believe that counterfeits affect not only your health, but even your wealth, because you lose money. But doctor, before we go to the vaccine, why do you think people then don't take counterfeits seriously? What is that intervening factor that is stopping?
Yeah, you know, also we need to understand that there's been limited sensitization and awareness. I think you're one of the few entities that is carrying out this awareness and sensitization. I have seen that even in media, the amount of airtime that is given or attention to it is very, very insignificant. If you look at every platform where discussions are made, counterfeits do not have a very big place in terms of discussion. So the issue of awareness is a very, very fundamental issue itself. And the sensitization, that needs to be strongly, strongly addressed. But also remember, it needs not just a bottom level approach, it also needs a top level approach. It should be a national issue. We've seen diseases like now COVID. The reason why COVID-19 has now become an issue is because it has been declared a global pandemic. We need to reach a point whereby counterfeits also are put at the same level as a global pandemic, such that it is seen as a public health priority. The moment it's put as a public health priority, it becomes the agenda of every country. It becomes an agenda in every boardroom. So it's very important that that level of intervention needs to be taken up to ensure that is achieved.
Okay, so I think you've had Dr. He's supported what we are trying to do here on a daily basis. And it's not only us who hold the view that the issue of counterfeits is paramount. But now we need Dr. to move to what is in the news now. I saw a clip, and like you have said, I think it was about a minute or two on national news, when the State House Health Monitoring Unit bust a network of people who are making, distributing, and dispensing fake COVID vaccines. And I thought, wow, this is getting really serious, because if somebody can have the audacity to fake potentially a life-saving vaccine, I know all vaccines are, but in such times, somebody can have that creativity and intention to make money off and at the expense of other people. I thought that was a big issue. What do you know as somebody in the medical profession, and I think you are on the committee on COVID, some government committee and so on. What can you tell listeners or viewers about that story that you know, beyond the 1 or 2 minutes people have got on the news? What's the story behind the story?
Yeah, so what basically happened is that there was an entity, an individual who was moving to different organizations, very high level of organizations, corporate companies, banks, telecom companies, and he was offering to actually provide vaccination services to those institutions. As you're aware right now, there's a very big push and a very big rush to get vaccinated to get that protection. So that desperation was very, very high. And as a result of that...
He went to which institution?
These are like banks. If you've seen like Diamond Trust Bank, Bank of Africa, they actually went to them and they presented themselves that we're providing this service. Now, that is the first thing. It was an individual, not an institution that was presenting that. The second thing...
But why would the bank just allow an individual? Fred walks up and says, I want to vaccinate. Isn't there accreditation?
Yes, you see, this is where, first of all, the problem that you highlighted, that people are not taking some of these issues very seriously. Because there was clearly guidance that was given that, one, these vaccines will only be given in selected gazetted sites. Most of those sites were government facilities, and where there were private health providers, they were clearly indicated and published. But here is somebody who comes and says, I'll bring it to your facility, to your organization, to your offices, and vaccinate.
Doesn't that person come with a reference letter from the Ministry of Health? Or?
Well, there was nothing. This is a person who presented himself. That was the first thing. The second complexity in the matter is that the nurses that were being used were actually those who are public servants. They were working in facilities, government facilities itself.
The nurses who went with this person, who approached the banks and the institutions, were official health workers.
They were official health workers, and therefore it brought an element of credibility in the eyes
the whole scheme
of the scheme itself. So this person tried to make sure that he teamed up. It was not the government institution, but it was the government. So it was more or less a syndicate of an individual and a few unscrupulous persons, nurses who were working in these health institutions, that teamed up to try and provide this particular vaccination itself. So that was the first thing that happened. The second thing, then they went ahead and did massive vaccination, and it was paid for. It was not free. They were paying about 100,000 to 200,000 per person. Yet this was supposed to be a free product, a free vaccine. Now, when you add up the total amount for 800 at about 200,000, it's about 160 million Uganda shillings, which is slightly above 40 to $50,000. If it was 2 doses, it was going to be $100,000.
Maybe even some paid in advance for the second dose.
Yes, they could have those that have paid, and we do not know who else could have had the service that we've not yet, because investigations are still going on. What has just been identified is the 800, but we also do not know if there could be other similar schemes being done. So it becomes a big challenge. So that was the second issue that was being paid for, being done in an ungazetted area, and the person who was handling it was an individual who was not accredited. So that's the three issues. The other issue that what came out ultimately, and that's what helped confirm that it was actually a counterfeit, is that they found that these particular vials of the vaccines had a batch number which could not be traced in the government system. It could not be traced in the National Medical Store system. National Regulatory Authority also could not confirm, clearly could not see this particular batch number as having entered Uganda. So that is where the key issue arose. But even when they started looking at the product itself, the seals looked to be very, very suspicious. You know, so the product itself also, the batch number is what really brought out the issue that this is not an authentic product.
So this was part of these AstraZeneca vaccines which came into the country?
It wasn't part of it.
No, I'm saying the fakers were pretending that this is AstraZeneca.
Yes, that is what they were claiming, this is AstraZeneca.
But
so
isn't the handling, maybe just explain, how does this AstraZeneca vaccine come in? Who handles, who checks, who stores? How is the movement? Who disposes of the empty? Are they, after you've emptied the bottle, is it thrown? Where did these guys get the empties from?
Yes, so this is where the syndicate happened, because one, they were also issuing out vaccination cards, government vaccination cards. Two, they were also issuing out stamps from a health facility. So all this had been faked, you know. Now, the containers, when you look at what has been presented currently visually, it appears to be that they could have used the empty, disposed of vials. And those are the ones
vials are the empties?
The empties, yes. So those are the ones that they will possibly, and this has been seen before, that there's always a tendency that the empty bottles, the empty vials are collected.
But doctor,
then those are the ones that
I would expect some form of accountability by the Ministry of Health. If you receive 600,000 doses, I remember they announced, isn't there, as a form of accountability, isn't there a need for the ministry to account for those empties as well, from where they have come? If you say, I have vaccinated 600,000 people, what proof do you have that you have vaccinated 600,000 people? We need to see the empties as well. There is no system of return of these empties. Are they just thrown?
You see, that's another issue. We need to strengthen the system. Right now, there's accountability of number of people vaccinated, number of doses of vaccines used, but the empties is not accounted for. I can correlate to narcotics. Narcotics is one of the most highly regulated products in any country, whereby even to import it, you need some special clearances. Even when you've imported it, you need to account for every quantity. Even when you're taking it for destruction, you must account for the destruction itself. We need to have what we call a 360-degree accountability, not a 180-degree or a 270-degree accountability. It should be 360 degrees, that until that empty is verifiable, stored in a particular location, and when it needs to be disposed of, it is disposed of when it is witnessed, such that it is destroyed and there is no possibility of anyone
So doctor, what you are saying basically is that the Ministry of Health is to blame in a way for these fake vaccines, because it did not handle the disposal of the vials.
You know, for us in the pharmaceutical world, we normally don't apportion the blame to an individual. What we call it a systemic failure. It's a system failure. The system has failed because the system was supposed to ensure that even after you have administered the vaccine, there is no risk to counterfeiting of that vaccine. So it's a system failure, and that's why I talked of system strengthening, so that we can be able to plug those gaps.
But the Ministry of Health is in charge.
Yes, they have a responsibility.
Oversight.
They have a responsibility, and that is why now the investigations need to unearth, because there are a number of questions also. The vaccination cards, that should be a controlled document. It should not just be on anyone's hands. How did someone end up with 800 vaccination cards in their hands? How did they end up with a seal and a stamp for an organization, a government institution, into their hands? So there are questions that need to be answered. They may not be directly responsible for it, but there's a role that will have played to avert it, especially if those vaccination cards were not available, if those stamps were not available. I am sure it will have been more difficult for these counterfeiters to take that course of action and engage in that fraudulent practice itself.
I can tell you that if this was a shootout on some big person, by now the perpetrators, the conspirators, those who are remotely mentioned in the case would have been put in the drone, in those army vehicles, the sirens would be going all over the place. Why is it that faking of the vaccine is not receiving the same kind of attention? And why is it not looked at as a security threat to the country? Because these nurses, I'm sure, if they went to Bank of Africa and all these institutions you've talked about, they have cameras, they can retrieve CCTV, and I'm sure even names are there. How come 3-4 days later, we are still there, the case is being investigated? Do you think the state is taking this seriously?
Yeah, I think that's where the big issue and the big concern is. To me, actually, I always say that the moment a product has been counterfeited, like a drug, and administered to a person, I equate it actually to murder. Because we do not know what has been administered. A vaccine is supposed to be sterile. A sterile facility, if you look at Uganda as a country alone, we only have one sterile facility out of all the many manufacturers that we have. So already there's a very big concern that what has been administered, even if it was water, this is water that is contaminated, which is supposed to be sterile. So I always say that, you know, counterfeiting for medicines is equivalent to murder.
Or
Ideally,
terrorism.
yes, they are supposed to look for this person with the same level of effort that you look for a murderer. And I can say that the response that has been given so far is not adequate. We needed a full-scale response. That's why I've said there is need for a 360-degree approach.
But now, Dr. Opio, you are now part of government.
Yes.
Why don't you do something? I don't know, is Parliament open? Why don't you go on the floor and say this issue of counterfeiting of COVID vaccines and so on, it should be taken at the level of a terrorist attack on the country, and all security resources must be deployed in the same way they deploy when a bullet is shot and somebody is injured. The way it's looked at is so different. Why are you considering that as an MP?
It's a very key issue, and I've had some discussions from different circles. And what is coming out clearly is that we have very, very weak laws. These counterfeiters do not go and counterfeit before they have understood the law. They know very well that even when they get them in now, they know that they can get out. It's just a matter of days they can be able to get out. That is one of the big issues, because I've even tried to engage some of the regulators, and they will tell you, look, we've been on this road before, but every time we get on this road, you spend a lot of resources, a lot of effort, you even go and apprehend these people, but some of them have the audacity to tell you that, I will see you in a week's time, I'll see you in 2 weeks' time. So that again has significantly hindered the progress of this. So there's need for very strong laws. And one of the efforts I want to put in Parliament in the next 5 years is to introduce a private member's bill on counterfeiting. We need to have very strong pertinent action that is taken. Then the law must demand the agencies and entities to take action in a very, very precise and in a fast-tracked manner, but at the same time it must be punitive enough to discourage further occurrences. Because remember, this is not the first time. We had the incident of the hepatitis B vaccine. Do we know how it ended up? It's not very clear. So it really points to the fact that there is need for a lot of top-level intervention at legislation level so that this becomes a priority issue, not an issue that is individual.
I think, Doctor, the law sometimes is used as an excuse. I'll tell you as a lawyer that even if we do not have in form of sentences and punishment, things like 50 years or life imprisonment or death, we actually do have legal sanctions in place for counterfeiting of a trademark under the Penal Code, under the Trademark Act. They have sentences there as low as 6 months to as high as 3 years or 6 years. But we are not even having anybody put in jail for 3 months or even 6 months. I think what you're describing is okay. Let's have more punitive sanctions. But even if you had a death penalty, we have a death penalty for murder, but murders go on every day. The death penalty did not stop the murders.
Yes.
I think what we need is more capacity building in the investigative arm. How cases are lost is they are poorly investigated, exhibits get compromised. I'm sure in this case of the COVID vaccines, the case may never see its day. The accused may never, first of all, they may not be got because of maybe the people are compromised. But even when the evidence is produced in court, it might be tampered with, and on a legal technicality, it gets off the hook. There is a need to strengthen the prosecution capacity. There's a big weakness there. And then there's also a need to strengthen the judiciary arm. Because I can assure you that cases of this nature are not handled at the highest level. They will be handled with due respect to a magisterial court or a high court at some level, but there isn't sufficient muscle. So the counterfeiters will get an army of strong lawyers who will punch holes, because you see the responsibility is on the prosecution to prove. So those are some of the challenges in there.
I just wanted to highlight that we should also understand one thing. If the counterfeiters had no market, will they have any business counterfeiting? That is also the other key thing we need to understand. We may have challenges with the justice system, with the legislative system, but we also need to have the element of the public. If the public is able to ensure that they do not give a place for counterfeiting, because when you look at for the vaccine case itself, this is clearly a non-accredited institution. Already the first thinking ideally was that why? And as much as you blame the government, the next question we'll ask is why did these organizations accept for a vaccination service, which they know very well is free, but at the same time which they know very well is from gazetted sites or indicated sites? How did
Why
they
did they accept?
Accept from an... So there is actually also an issue.
We are to blame as consumers.
We as consumers
for our own
also
negligence as well.
Yes, so it's a, I could say it's a triple issue. You know, the legislation, the justice system, but also the citizenship has a very big role to play on that, because they are creating a breeding ground for the counterfeiters. If none of them had accepted, this person would have had no business counterfeiting. So I think it's very, very important for that.
And the other thing I have seen in these counterfeit cases, we've done several cases, arrests are done, goods are impounded, but sometimes the owner of the case, the complainant, refuses to come and participate to support the investigations, and the case dies out.
Yes.
Why does the case die out? Because somebody doesn't come to make the statement, and so it's hanging. The file never gets processed. So the police officer or whoever will say, sorry, we cannot proceed. So you might find that it's going to be difficult for that case to proceed if the institutions, the banks that you're talking about, do not go actually to support and give evidence. You might find they will dilly-dally. And then there's also this issue, which I think is based on lack of maybe knowledge. Some people will fear. Some people will fear to go and testify. They will say that I don't want to be targeted. I don't want to appear that I'm the one who is reporting these guys are dangerous. There's also that problem. It's a big challenge. So what we are trying to do here on the show is to ensure that we have an informed consumer, because an informed consumer is an empowered consumer. That is our agenda here.
Sure.
The issue of Covidex. First of all, you know about Covidex. What do you know about Covidex?
Well, Covidex is a product that has been innovated by one of our members of the Pharmaceutical Society of Uganda, who is Professor Ogwang. He's a well-educated fellow, researched fellow. He's
Professor
been a lecturer.
Ogwang.
Yes, Professor Ogwang. And
Yes.
Of course, it's always good to give that confidence, because at times there's a concern of that you can also have fake people. But that just to give the assurance.
Some people think he's a herbalist because this is a herb.
You see, we need to understand that drugs, many of the drugs that we take,
Is he a herbalist?
come from, he is a specialist in herbal medicine. That is who he is. So he has studied herbal medicine.
So herbalists and herbal things
see,
are okay.
I
because
don't-
there's a thinking that no, you should shun
You see, I always want to limit to legal and professional definitions. If you ask me the definition of a herbalist, we do not have anywhere that is clearly defines who a herbalist is. But you go into the public definition of a herbalist, they will even add a witch doctor, in addition to that, a wizard, and one who has those
and
African...
the guys who are in the buses selling.
Exactly.
And the Maasai
So-
guy is also who move with
Exactly. So we wouldn't want to bundle on that. But he's somebody who has widely studied herbal medicines. And as a result of that, therefore, he's a pharmacist by profession, a pharmacologist who has studied drugs also by training, and is widely researched on quite a number of plants for their medicinal uses itself.
But this week as well, we have been seeing reports on social media where they say that now, after NDA cleared Covidex, that there is some possible fake versions of Covidex on the market. And this information we got, our investigators got this information from the market. And with me here, I have carried 2 samples. I want to see whether the expert doctor here can tell us whether this is genuine, whether this is fake or not. I'll put them there so that they can be viewed. One of these was bought at Royal Pharma for 30,000 shillings. The other one on Wilson Road here in Kampala. The other one was bought at Vanguard Pharmacy, Ntinda branch. Okay? So we have 2 products here, which I'm going to hand over to Dr. Sam Opio. Can you help us? Because people are confused. People are posting, this is fake, this is the genuine. What can you tell them?
Yeah, I think it's important that, first of all, normally, if any product, specifically a drug, is identified and people think it's a fake product, we normally, the first level is we call it a suspected. It's not a confirmed fake product. So normally there could be some features that could make people suspect that this could be a counterfeit product. Now, some of the features, and I normally start from the out, going back inwards. One of the features starts in from the packaging itself, where people will try to look at the packaging and see if there are variations between the packaging. Then that could lead somebody to suspecting. There could be variation in terms of the spelling of the name of the product. That can lead you to being suspected. There could be a variation in the color of the labels or the color of the packaging, or even in the
Maybe, doctor, I
expiry
can
dates.
before
So
you
if we-
explain,
yes,
I
please.
can tell you for us what our own analysis as people who look at, who have experience in looking at counterfeits. What we saw, the difference here, was that this cover here is dark. This one is lighter. If you look closely, they're all green, but one is dark, one is light. The other difference we saw is that this one here has a gap between the top cover and there are some spokes in there in the middle. This one has no gap at all. For us, those are the 2 things we we are seeing. What else do you see, and how can you help?
Yeah, so I think the first thing is that what we can say we've observed is that there's a variation between the color of the packaging. One has a lighter color, one has a darker color. When we look closely, normally in most cases, the details of the manufacturer.
Maybe show the camera.
Yeah,
What,
so
what are you
for
seeing?
this, what we're seeing, there's a name written here as Best Pack. This is a
Best Pack.
Best Pack, yeah. This is one of the manufacturers of packaging materials in this country.
Where is Best Pack found?
Best Pack is located in Matuga, which is just about 20 kilometers.
Best Pack.
20 kilometers from Kampala.
So this is a container made by Best Pack.
That's made from Best Pack. When you look at this other one closely, this there's just an initial C, so the manufacturer has not made the details there. It's not indicated there.
This one has no name. It has an initial C.
Yes.
Why is it important to have a specific manufacturer of the container of a drug? Can't any container work?
Yes. So it is the main importance is for traceability. So in this particular case, the next thing that I will check, because here what it means is that these are the containers, the packaging materials are from two different suppliers. So the next question to ask is whether the manufacturer, the innovator, that is Professor Ogwang's company, whether they actually have these two as their approved suppliers. If they don't have these two as their approved suppliers, then a lot of questions then will be raised that there's a potential that this suspected counterfeit could.
So the first thing is to find out,
yes,
Dr. Ogwang, who is your appointed supplier of the container?
Yes.
If they mention the name of the company there, so the chances of that being genuine, because the container is from a genuine supplier, are high.
Yes. That
if Dr. Ogwang doesn't know the supplier or the manufacturer of this other product, then in terms of the packaging being suspect, the contents can also be suspect.
Yes, it can
That's
be
what
suspect.
You're saying.
That can be suspect. The other testing criteria, I told you about the vaccines. One of the testing criteria they used was looking at the batch numbers. Now, when you look at this, the batch numbers are the same. The manufacturing dates are the same. That is June. Expiry date
Both
is
have
also
the same date?
Yes, they have the same manufacturing month and the same expiry month.
Wait.
Normally,
can they have the same, can two bottles have the same batch number?
yes, the batch number is the same. You see, a batch can be a batch of about 1,000.
Okay.
Yes, but the expectation normally is that if I have a batch of 1,000, I would have possibly the same supplier of packaging material. I would change in a second a different batch. So there will be you will expect, there will be an expectation of the differences in the what? In the
so
batch
you
number.
cannot have a batch with 1,000 bottles, 200 bottles from another bottle manufacturer, 50 from another. You're saying it should ideally be the same.
Yes, it's very least likely. Normally what is the expectation is that you will have the same supplier for that particular batch. Because as I said, you can have two suppliers. But how do you manage the two suppliers with your product? You will have one particular batch with a dedicated supplier, and then a second particular batch with another supplier itself. So those are some key questions or investigation questions that will possibly trigger off further investigations to confirm whether these products are actually, which one of these is genuine, whether both of them are genuine, or there could be a possibility that there could be some challenges or issues related to counterfeiting itself. But also, you know, people change also suppliers. We could have had some supply chain constraint itself. You've seen vaccines. You know, Uganda is trying to now look at other vaccines from other suppliers.
From Russia.
From Russia.
From Uganda.
From
Are you
Johnson
part of the
Johnson.
Ugandan vaccine team?
No, I'm not part of that. Yeah, but I know there's a team, there's a very competent team that is working on that. Yeah.
Okay,
so
back to Covidex.
So as I said, when you are evaluating, the investigation begins from out inwards. So you look at what we call the visual properties, and that's what we've been looking at. After visual properties, we have what we call the organoleptic properties. Organoleptic simply means you use your senses. Senses can be the sense of taste, it can be the sense of smell, and then to make that comparison. Of course, I wouldn't encourage anyone to test because it's a drug, but you can use your senses of smell and see if there's any variation in it. But you can also use your senses of eyesight to check whether the appearance, you may find there could be differences.
But now,
in
doctor,
appearances.
I have given this to you, and I'm telling you that people are confused. Yes. How can you help them now? Because for you, you are an expert in these things. Maybe, okay, you're not the manufacturer. We did actually try to get Professor Gwang on the show, but he was not reachable. But since his friend is here, how do we now practically, using any senses that are available to us, can we try to see if there's a difference? Because they could all be genuine.
Yes.
They could all be fake. I don't know.
Sure.
What other way can we?
Yes, so as I told you about the organoleptic, you can get a glass, empty each of the contents. So why don't we empty and see? Yeah, I think we can. If there's a difference, we can do that, and that could possibly help us.
I will empty. So I open this, and then I empty everything here. Okay, we have a big glass. So this is. Are you smelling anything?
I'll need to bring it closer, then we can be able to.
But it's like juice.
Well,
so somebody can drink this thing?
Not
After all, they put in the throat.
Yes, okay. But remember there's the dosing.
It's smelling. Okay. There's something smelling there.
So that seems to have a strong, some strong aromatic smell. From
smells this. Like there is this local thing. They call it chisubi.
Yes, there's some scent of, that is a lemongrass.
So this is this one now. It has a dark green cover. The one which has a gap in between. Is there any? This is more pungent. This
was the
stronger.
first?
That was the first. That one is, it doesn't have a very strong.
Okay. From the observations, this has there appears to be some strong lemon smell.
This
lemon,
one?
Yes, the lemon, this is a lemon flavor smell on it. This doesn't seem to have that flavor on it.
So this is the one with the light green cover. This is the dark green cover. Now, if this has more of lemon, from the way you're smelling, is lemon one of the ingredients in Covidex?
Well, what has been indicated here are the extracts that it contains, but we do not see, you know what, normally what is expected is you indicate the key active ingredients.
Yes.
Now here what we're observing is that there seems to be another different scent. There's a difference in
different
scent.
Ingredient.
Difference in scent, which could imply two things: difference in ingredient or different in concentration of ingredient. So those could be the differences itself. So that's when I said we're now moving from the visual properties to the organoleptic. We've been able to note there appears to be some variations. Now the final confirmatory test now will be the chemical tests to actually confirm the contents that are present within this.
This has more lemon. So yes, there is a possibility, we are not confirming, but there's a possibility that these two samples, the one with the lighter green and the one with the darker green, are not from the same manufacturer. There's a possibility.
So the first test, we've observed some variations in colors. The second, we've observed the variations in the organoleptic properties itself.
The internal?
Yes, the internal. So the third will be now the chemical test to actually confirm the actual composition, because this is just organoleptic. We need to check what actually does it contain itself. And then that will be able to guide on drawing a conclusions whether this is was a counterfeit or it was just suspected but ended up actually a genuine product itself. So additional tests are needed, but this also brings out, you see, these are the skills which the public can easily develop and use to alert the regulatory authorities, as SCN has just done and presented this to me.
Can you take up this issue, please?
Yeah, I think this is something that we are going to take it up. We're going to share it with the innovator and the manufacturer to be able to investigate and be able to confirm whether these are actually genuine products or there are actually some issues as far as this is concerned.
Because we don't know what we are taking. The public is demanding to know what is the correct product or not. This is a product that is a life-saving product, as it were.
Sure.
So the counterfeiter, if they are counterfeiting, is taking advantage of the abnormal demand. I'm told these prices have moved from 10,000 to 30,000 to 50 to 80,000 to 110 the last time I checked.
Yes.
So I think that there is a need to protect the public. You, the doctors, must come out. I am hoping that in the next couple of days, because this, who knows who is getting harmed. I'm hoping that Dr. Ogwang can come out to explain, but you can reach him and come up with this. So I think we need to see how to close this, but we cannot close Dr. Opio without talking about some other alarming issue, which also borders on counterfeiting, because counterfeiting is not only in products but also services. There is counterfeit medical services being offered in the form of exorbitant medical charges for treatment of COVID patients, in the form of unethical conduct by some healthcare givers who demand for money first before somebody is put on oxygen or given treatment, and yet the medical and dental practitioners law requires that a medical practitioner is obligated to provide medical attention in emergency situations to a patient. But you have people who are losing loved ones because they say deposit 5 million. And they say, please put oxygen, let me go and bring 5 million. They refuse, and they find the wife or the sister dead, and then they are faced with a bill. What is happening? I thought that medical practice or provision of medical services was a service. Have you guys turned this into a trade, a business for profit? What is your comment on what's going on, the public outcry?
Yeah, first and foremost, we need to take note that medical profession, whereas one may say it's your profession or it's a service, it's a regulated service. Regulated means that you do not offer those services in the way that you desire, but you must offer it within certain dictates. When I talk of dictates, it means they're ethical dictates, there are moral dictates, there are professional also requirements as that is concerned. There's a code in which every doctor, every pharmacist, every nurse, and there's also an oath that we've all taken that will put the patient first, and that is the primary aspect itself. Now, putting the patient first means that profits are secondary. Your first objective is the patient, and I need to emphasize that. The issue about high charges, we would expect that during such a time, because I've tried to see some of those charges and we've tried to see some of the justifications, but it's still quite a big issue because these services ideally shouldn't be as high as they're being claimed to be. Yes, they are high operational costs, but an ICU, there is cost on the medicines, cost on the personal protective equipment, cost on the oxygen, but when you add it all up, there seems to be some element of over-profiteering without the patient. We've seen cases of dead bodies being detained. That is a patient. You cannot detain a patient, leave alone even a dead body. You can't detain a patient. It is not ethically acceptable. So we need to understand that. And when you talk about counterfeits, even in such scenarios, one of the issues the public needs to be very cautious with is oxygen, because people have been rushing for oxygen, but they need to understand that the oxygen that is required in the ICU is medical oxygen, not industrial oxygen. Industrial oxygen is used for welding, and the difference between it is the purity. There's a risk.
What do you mean? So the oxygen now here in the room is what?
Yes, what you should understand, what you have
oxygen
here
is this?
This is air. This air contains about 21% oxygen. So 80% of it are other gases, other impurities. You can even have smoke particles in it. But what we're talking about
pure
is
oxygen.
Pure oxygen. That is the one that we're talking about. And this is medical oxygen. The grade is medical oxygen.
So how come we have a shortage of oxygen, yet we don't have a shortage of air?
Yes, that's the whole thing, because oxygen now is a product. Air is the raw material. You can have a lot of the raw material, but if you cannot process enough of the product out of the raw material, then it becomes a challenge.
So how is it processed?
So the challenge is that, it goes through a purification process. And that purification process, there is capacity issues. You've seen some facilities will tell you, we can only process an equivalent of about 600 liters of oxygen a day. Yes, you have 10,000 liters of air, but if your only capacity is 600 liters, processing capacity is limited, but there's also storage capacity. You could be able to process more, but you only have 40 cylinders, which can hold only 200 liters. So there's processing capacity, there's also storage capacity. So those are some of the limitations itself. But that brings you back again to the issue that, these issues of high ICU costs, there is need for controls to be put on prices. That is very, very important. Because we're in the middle of a pandemic. I've seen other countries whereby they have laws that prohibit excessive increases in prices during periods of disruptions like pandemics. And they put a cap that you cannot increase by more than 20% of the price preceding that incident.
Before the pandemic.
Exactly, before the pandemic. Here, if you look at their prices, some have gone 500% higher.
But
so
doctor,
it's also because there are no adequate
some people might
that.
see you here and think that you're just doing a PR exercise, because now you are a new convert, you're a politician, so you're trying to win over, people to say you're nice. But how come you have not, before now, as the medical association or, I don't know, pharmacy association, how come you've not come out to reprimand or to sanction your colleagues who are running private hospitals and profiteering, as you say? Why haven't you taken action?
No, it's not that we've not taken action. Uganda Healthcare Federation is the umbrella body that brings in all the medical association, the pharmaceutical association, and we've had a series of meetings. In this last 1 week, there's been a meeting, and in that meeting, when they did a lot of analysis, they found that the cost of ICU services can actually be brought down to about 1 million shillings.
1 million shillings?
Yes, 1 million shillings per day.
But we are going for 5 million, 4 million per day.
However, they highlighted some interventions that are needed. You see, what is happening is that ICU is the point of convergence of all health supplies. All the masks will converge at the ICU. All the PPE equipment, the protective overalls they put on converges. All the oxygen cylinders, all the drugs converge there. So the problem that happens is if each of these 5 or 10 commodities or supplies being used in the ICU, if the suppliers have tripled the prices or doubled the prices, then you end up having what you would call an astronomical
So why don't you
increase.
just go and stop them? Why don't you march from here after this show?
Yes.
Go with your committee and stop them, because their body is being held. I have just seen here on social media, there's a letter written by lawyers complaining. This thing is recurring. You people are just in meetings. This letter is written by Luzige Rubega, Kavuma and Company Advocates. It's addressed to Paramount Hospital in Kampala. And the effect of this case is that they are asking for release of the body of the late Namugenyi Teresa. And the lawyers are saying that if the body is not released, they are going to take action. Now, are you waiting for people to go and burn up these hospitals? And I need to inform you, by the way, that it's a criminal offense to hold a dead body. They're what they call dead persons' rights in law. They are entitled to burial. Anybody trying to block a body from going for burial commits an offense. Even then, it's against our culture. And I think I was reading somewhere, one of the patient rights, because we even have a patient's charter. These things never mean anything. one of the patient's rights here is the right to dignity. Dr. Opio, the right to dignity. You're familiar with this. The patient's dignity, culture, and value shall be respected at all times in medical care and teaching. Likewise, terminally ill patients shall be entitled to humane terminal care to make dying as dignified and comfortable as possible. In other words, what the hospitals in Kampala are doing is to they are bringing indignity, they are bringing humiliation to the dead. You understand? And the charter says you can't do that. And even the law says it's an offense. So rather than say we shall have a meeting next week and see, we have an issue now. What kind of assurance or hope, because there are so many desperate people with heavy bills stuck on them, what kind of action can be taken now, as in the now, to resolve this issue? Can some emergency action be taken?
Yeah, I think this, you saw that a similar incident happened about 2 weeks ago, where there was overpricing of one of the unfortunate patients who passed on, one of the who was pregnant and died during birth.
Yeah.
And there were interventions that were made to ensure that that issue was addressed, and that was addressed at that particular time. This is a reoccurrence of a similar kind of incident itself. I've just come to, it has been brought to my attention actually
I can
right
share
now,
this later with
but
you.
it will be good to share with us, and then we see what action, but you see, all this is triggering the fact that we need systems intervention, so that whenever such incidences happen, it doesn't have to be an individual intervention, it doesn't have to be a legal intervention. The systems can be able to ensure that they intervene to avoid some of these challenges itself. So we are also in facing, of course, a period of, we could say, unethical practices, and this is some of them that are involved.
So what's your message to the hospitals which are...
So they really want to appeal to the hospitals. Let's uphold the ethical standards of practice that have been there before. We have deviated. That is, we need to recognize that. That is a big challenge. The pharmaceutical profession is now being seen as, somebody actually explained to me that, drugs are now seen as white gold.
Treasure hunters.
we had the black gold of oil, and now they're calling this white gold. We need to reshape our professions. The medical profession, the pharmaceutical profession, the nursing profession, there is a need of reshaping to be done. So this is
if
one
you
of the
don't
big
do that,
challenges
mob
that
justice can come. People
definitely,
will come up and
definitely there will be a lot of public outcry, and it's very important that these interventions are done, and as you said, in a very timely manner, not just to give the hope for that.
We have to be fair in our discussion. I think I've had the argument for the hospitals. They also need to recover cost of providing the service. They have to pay overtime, they have to pay more workers, they have to meet maintenance costs. Many of them are borrowed to have ICUs. How do you balance the patient rights with the rights of the healthcare providers? Are they equal? Is one higher? Is one lower?
In terms of the rights, first of all, we need to understand that there are certain services which cannot be fully privatized, because, as you said, the investment that you need to put up in an ICU cost is so high that if you start billing a patient, it becomes unaffordable to them. So we need to understand that there is always need also for some of these services. We cannot have them fully privatized. There has to be a government arm either to have the subsidies on it. So to balance those rights, obligations, and duties of the service provider, it's important for government to begin to start thinking of how do we assist and support by subsidizing ICU supplies and commodities, such that the patient's rights,
don't pass the whole cost to the patient.
They should absorb a percentage of it. That is very, very important. It can be done in 3 ways. It can be done outside the pandemic, outside the pandemic period, or it could just be limited to the pandemic period to ensure that these supplies, because as I told you, the over-profiteering is not just in the ICU costs, it's also in the supplies. But if government is able to intervene and say, look, we shall either subsidize or we shall absorb these prices, then we could be able to see that you have balanced it off. Because at the end of the day, they have workers to pay. But as I said,
but life is paramount.
Life is paramount. So we need to balance the two. The ability to maintain your operational costs, because we also don't want a scenario whereby these facilities say, look, we can no longer operate,
and then they close completely.
Yes, then it becomes a very big challenge.
So I think to be fair, if you help us get one of the healthcare facility owners, we put them on the show and they also explain their side. But I'm told we need to close. The parting shot, Dr. Opio, do you think we have handled well this COVID crisis as a country? Are there gaps?
There has been, I think now we need to look at it in terms of the waves or the lockdowns. The first lockdown was, I could say, was very well done because we were able to contain, because the objective is containment. And we saw that Uganda really had one of the lowest cases of deaths, lowest numbers of infections. And criticality was very, very low. Even the ICU hospitals were basically, we even had to shut down a national referral ICU unit because there were no patients. So the first one was really very well handled. Unfortunately, the preparedness for the second one, I must say, was quite low. But also now the handling has also been limited. As you can see, there are a lot of issues emerging, but response is still a very, very big challenge. So this second wave, this second lockdown, the handling has been not satisfactory. It could have been done better. I tried to explain, for example, what happened when the schools closed. There were children who were in isolation units, and some of them actually already were manifesting signs and symptoms of COVID. Now, when the orders were given to close the schools, the isolation units were also closed, and the children were sent home.
Into the community.
Into the community. Positive cases dispatched into community across the whole country. So you can imagine, and that's why they were calling it as super spreaders. It was now the children that became the big spreaders. The first lockdown, we were talking about the travelers, the truck drivers. In this second one, we're really looking at it's the children that have done that, you know. So that has been the very, very big challenge itself. So the handling is quite wanting. There is need, because we need to understand this might not be the last wave. There could be new waves coming up. We need to ensure that there's a strong response and preparedness plan to mitigate some of these challenges that we faced.
Dr. Opio, thank you so much. You didn't tell us when the corona virus will go away. We were hoping you would make a big announcement. When is this ending? How many more weeks?
We need to look back in history. Smallpox, we've had quite a number of these pandemics. The Spanish flu, some took
that was then
5 years.
When is corona ending?
7 years. Corona will end once we get an effective vaccine and an effective cure. So when that will happen is what we're waiting for the research arm to tell us.
So we might have Christmas with corona this year as well.
Well, let's pray not, but let's also be prepared in case that happens.
That was Dr. Samuel Opio Acuti. He is wearing two hats here. He's been talking to us as Secretary General of the Pharmaceutical Society. He's also talking to us as a doctor, a medical doctor. He's also been talking to us as a politician, an MP, a new MP for Kole North in Lango sub-region, northern Uganda. You didn't tell me your party, but never mind. We are now dealing with a national issue which knows no parties. He has been discussing with us issues to do with COVID treatment, COVID vaccines, which we have learned have also now produced fakes on the market. He's given a strong message, a strong appeal to all of you, not to just wait for fake COVID vaccines or treatments, to pay attention to counterfeits. But his message is, like we always say, pay attention to counterfeits at all times, whether there is COVID or no COVID. We would like to say bye for now by saying don't be fake, buy, sell only genuine products. Until next episode, thank you.